Welcome. Welcome to Consumers Doc 1, Dr. Bengala. Thank you for joining us. Today's topic, universal healthcare versus consumer empowered healthcare, so-called dollarcare.org, healthcare Amazon. Universal healthcare. Let's look at the pros and cons. Universal healthcare is basically giveaway for free. There's no accountability. You get the care. You have to wait in lines, because anytime you get for free, folks, there's always waiting lines, like what we see across our neighbors in Canada and England. To get appointments, to get to see a doctor, there's a big waiting line, because you're getting the care, whatever it is. It's a bureaucratic machine. There's too much paperwork, it's intertwined with the government and social network. But the services, what you get from the universal healthcare is you get what we pay for. If you're not paying for anything, obviously you have to wait in line. Americans will never tolerate that. Americans will never tolerate that kind of a system. I'm telling you, from the practical, me being in healthcare for the last 40 years. Okay. I explained to you about the drawbacks of universal healthcare. Okay, let's talk about consumer empowered healthcare Amazon, so-called dollarcare.org. It is a non-profit umbrella. It runs as a public-private partnership. Under the public-private partnership, you get to have a health review authority, and they take care of the people who need the most. If a person is economically impaired, physically impaired, if he's uninsurable, health review authority under the public-private partnership steps in, gives them a certificate of guaranteed coverage. Once you issue a certificate of guaranteed coverage, you can go to any insurance company. They'll love to have you, because they get payments from the health review authority. How do you set up a consumer empowered healthcare? It's simple, folks, very simple. For an employer and an employee, large or small group employers or employee, most of the larger employer groups are already self-insured. They're already getting the benefits of health insurance with health savings. I'm talking about most of the uninsured we have here in the small business, like mom and pop restaurants, small grocery stores, grocery chains. Their employees, they can't afford to pay the health insurance. This is where my idea kicks in. If an employer has about 3 employees or under 50 employees, it doesn't matter. As long as he's paying for the workman's comp and he's paying the wages, under the workman's comp, there should be a provision where primary goal is to give a health insurance to the employees. Once you do that, employer can go out there and shop around for a lower premium, get a deductible. If the employee is healthy, if you can get a deductible health plan, whatever the employer can tolerate, 1,000, 2,000, 3,000. This is employer making a decision to bring down the premium of their employees. Once you do that, folks, employer will be saving lots of money. Yes, he'll be saving lots of money. If your traditional health insurance costs $200-300 per employee, you can bring it out at $50 to $100. So you're saving $200 to $300 right there. The money saved from the deductible health plan goes into health savings accounts. So employer contributes half and employee contributes half. This is the beauty, folks. Employer and employee contributes half. And you know what? Employee will be loyal to the employer because he's getting the health insurance what he needs the most. This is the beauty about employer-employee relationship. If employer is giving a health insurance, oh man, he'll be a loyal employee for you rest of your life. The health insurance creates bonds. Employer, small, I'm talking about under 50 employees. This is the best approach you can do. I would rather, workman's comp, they need to make some reform where you can 10% of it, whatever it is, the premium should go to the workman's comp, but the rest of it should be for the health insurance folks. Guys, if you like this idea, follow me. I want to spread this message, man. I want to spread this message so bad. Under the public-private partnership, we will have the best healthcare. And the beauty is, it's consumer empowered, not insurer empowered. Consumers always lower the cost. Once you give the power to the consumer, they demand affordability because it's coming from their pocket. So the cost of the healthcare will go down finally, and the technology is going to revolutionize the healthcare, folks. Technology is there. All this telemedicine, telehealth, whatever the COVID did, this is the big benefit we have now with telehealth, telemedicine. I foresee down the line doctors making house calls in the afternoon for sick patients, but most of the patients can be seen online, sitting at home. You don't need an office, you don't need a clinic, you don't need a biller, you don't need a receptionist, folks. And your malpractice insurance is so low because if there's a tort reform, it's so low. So doctors will love the tort reform with lower malpractice premiums online, and there's more accountability. There's no billing, folks, no billing. I'm going to set up a platform where you get the care and you pay for it. Pay as you go. It doesn't matter. It could be surgery, it could be x-ray, it could be radiology, it could be lab, everything. You pay as you get the services. Folks, if you like this idea, join me. Join me in this endeavor. I am passionate about it, man. I am gung-ho. I want to run for a governor of California. And California is always a leader when it comes to healthcare. This is where, there's a calling. I will run for the governor of California in 2024. Bengala for governor. How about that, folks? Thank you. We will see you in the next episode. God bless. Goodbye.